This is the Pixar avatar of Dr. Badman. I'm here to give you some recommendations. The purpose of today's video is to help you start preparing early so you are not scrambling at the last minute. There are a few optional items that many patients find helpful before and after shoulder surgery. None of these are mandatory, and many are not covered by insurance. But I want you to know about them ahead of time so you can decide what makes sense for you. First, I recommend picking up Hibiclens soap or wipes. This is a special antibacterial wash that helps reduce the amount of bacteria on your skin before surgery. You will use this starting 2 days before surgery, and again the morning of surgery. Please be advised, do not use Hibiclens on your face, eyes, or ears. Second, you may want to consider a cold compression unit. Cold compression combines cold therapy with gentle compression, and many patients find it more helpful and more convenient than ice packs alone. This can help with comfort and swelling after surgery and reduce your pain. You can purchase this through Amazon or through the link here that is provided. Third, think about how you are going to sleep after surgery. Most patients are not comfortable lying completely flat after shoulder surgery. Many people sleep best in a recliner or propped up in bed with pillows behind the back, shoulder, and elbow. Planning for this in advance can be helpful. Some patients also choose to purchase a shoulder sleeper pillow or a wedge pillow to make this easier. This can be purchased online through the link provided here. Fourth, I want you to start thinking about nutrition. Surgery increases your body's demand for protein and key nutrients. Good nutrition helps support wound healing, immune function, muscle preservation, and energy during recovery. Improving this in advance and the weeks after surgery has been shown to lessen complications and improve outcomes. I generally recommend prioritizing protein at every meal, especially breakfast and after physical therapy. An easy solution for this is purchasing pre-made shakes and amino acid drinks through Thrive Surgical Nutrition. This is designed specifically for surgical patients by surgeons and includes protein, amino acids, and other nutrients that help support recovery. These can be purchased at the link here. If you decide not to use the Thrive protocol, that is completely fine. Just make sure you are getting enough protein through food or another protein supplement. If you do use Thrive, please remember that the protein shakes are not to be taken the morning of surgery. This is very important, as if you drink the protein shake the morning of your surgery, the surgery will be canceled. If you decide not to use the Thrive protocol, I do want you to purchase some Gatorade G-Series drinks for the day before surgery and the morning of surgery. You will drink one 20-ounce Gatorade the afternoon before surgery and one 20-ounce drink in the evening. You will then drink one 12-ounce Gatorade 3 hours prior to your surgery. This again has been shown to help with recovery and anesthesia. If you are using the Thrive protocol, then the carbohydrate drink is already included and you don't need the Gatorade drinks. We will review the exact instructions closer to your surgery date. If you are undergoing arthroscopic surgery, please pick up a box of large waterproof Band-Aids. You will use these after your first dressing change. If you are having shoulder replacement surgery, then the waterproof Band-Aids are not necessary. So, to summarize, the items you may want to pick up or order now include Hibiclens soap or wipes, a cold compression unit, a recliner setup, wedge pillow, or shoulder sleeper pillow, Thrive nutrition shakes or another protein plan, Gatorade G-Series drinks, if not using the Thrive protocol, extra strength Tylenol, and waterproof Band-Aids if undergoing arthroscopic shoulder surgery. Again, not all of these items are required, but preparing early can make the days before and after surgery much smoother. As always, if you have questions about whether any of these items are appropriate for you, please contact our care team.